Could your loved one's forgetfulness be more than just aging? And if so, would you recognize the signs before it's too late? Dementia isn't simply a part of growing old. It's a serious neurological condition that affects over 55 million people worldwide, and often begins with symptoms that go unnoticed or dismissed. In today's video, we're going to explore 9 early warning signs that can easily be mistaken for normal aging, 13 classic symptoms that demand medical attention, and the underlying causes that drive this condition. We'll also share scientifically proven strategies to help maintain cognitive health, because prevention is possible and early recognition makes all the difference. Let's begin by understanding what dementia truly is and why it's so often misunderstood. What is dementia, and is it inevitable? What truly defines dementia? Is it simply a byproduct of old age? Or is it a distinct medical condition with its own warning signs and underlying causes? Dementia is not just one disease. It's a syndrome marked by the progressive decline of cognitive abilities, impacting memory, language, reasoning, and behavior. Contrary to popular belief, it is not an inevitable part of aging. While age is a major risk factor, dementia arises from actual damage to brain cells, most often caused by conditions like Alzheimer's disease, strokes, or Lewy body accumulation. So let's be clear, growing older doesn't mean losing your mind, but ignoring early signs might. Let's stop normalizing cognitive decline as just aging, because recognizing the difference early on could mean the difference between intervention and irreversible progression. The 4 major types of dementia you should know. Just as we differentiate between heart diseases, we must distinguish the types of dementia. Alzheimer's disease, the most common form, involving memory loss and disorientation. Vascular dementia, caused by impaired blood flow to the brain, often after strokes. Lewy body dementia, presents with hallucinations, motor issues, and cognitive fluctuation. Frontotemporal dementia, marked by personality shifts, impaired language, and behavioral changes. Each type requires a unique approach to care and management, so understanding the type is as important as the diagnosis itself. 9 early signs of dementia that often go unnoticed. Let's dive into subtle red flags that families often miss until it's too late. Number 1. Struggling with words. Is it just a senior moment or something more? When a person consistently stumbles in conversation using vague language, forgetting common words, or confusing names, it's time to pay attention. Language difficulties often emerge first and quietly erode our ability to connect with others. These aren't isolated incidents. They're patterns. Number 2. Changes in the senses. Can trouble smelling your favorite food signal brain decline? Yes. Dementia can alter vision, hearing, taste, and smell. If your loved one suddenly has trouble recognizing faces, gauging distances, or loses interest in eating due to taste changes, it could be more than aging. Number 3. Lack of motivation, apathy. If a once active person now avoids social events, hobbies, or even small tasks, they might not just be tired. Apathy is a hallmark of early dementia and is often mistaken for depression. But unlike depression, it lacks sadness, just absence. No drive, no energy, just a slow withdrawal. Number 4. Muscle weakness. Why would dementia affect your grip strength or balance? Cognitive decline affects more than memory. Conditions like Lewy body and vascular dementia often impact motor skills early, causing unexplained weakness, tremors, or poor coordination. Falls may not just be physical, they could be neurological. Number 5. Getting lost in familiar places. Imagine forgetting how to get home from your favorite grocery store. Spatial disorientation is one of the most distressing early signs. People may become confused in their own neighborhood or even within their own home. That's not just aging, it's a cry for help. Number 6. Sleep disturbances. Does someone you know become more confused or agitated at sundown? Sleep issues, especially sundowning, are common in early dementia. This includes insomnia, fragmented sleep, or late-day confusion. Poor sleep isn't just tiring, it accelerates brain degeneration. Number 7. Hunched posture and gait issues. Is your loved one walking differently lately? A shuffled gait, stooped posture, or freezing in place can all signal early cognitive impairment. These aren't just orthopedic issues, many originate in the brain. Number 8. Everyday tasks becoming complex. Paying bills, following a recipe, or even using the microwave suddenly seems confusing. When someone begins making repeated mistakes with routine tasks, that's a red flag. It's not just forgetfulness, it's executive function decline. Number 9. No interest in talking or socializing. If someone suddenly avoids conversations or becomes emotionally flat, take it seriously. And a lack of pleasure or interest can precede major memory symptoms. It's a silent withdrawal that often goes unnoticed. Now that we've covered the subtle early warning signs, it's time to look deeper. These are the 13 classic symptoms of dementia, the ones most frequently seen in clinical practice, yet often misunderstood or overlooked. Recognizing them early could make all the difference in how we support, treat, and protect those we love. 13 classic symptoms of dementia that deserve your attention. Difficulty following conversations. Do they suddenly get lost mid-discussion or ask you to repeat yourself often? This goes beyond hearing issues. Dementia can impair processing speed and memory, making group conversations feel overwhelming. If someone struggles to track what's being said or interrupts with unrelated thoughts, it's time to dig deeper. 2. Loss of time awareness. Do they forget the day, month, or even the year? Temporal confusion is a hallmark of dementia. It's not about forgetting a date. It's about losing the sense of time altogether. When someone insists it's still 2019, or can't recall if it's morning or evening, that's not trivial. It's cognitive disorientation, difficulty making decisions, simple choices. What to wear, what to eat, become frustratingly hard. Dementia impairs executive function. The person may become overwhelmed when presented with options, unable to weigh pros and cons or follow through. Even familiar financial decisions might now require help. More social withdrawal and isolation. They no longer attend church, avoid family dinners, or refuse phone calls. Why? Dementia makes socializing exhausting. Processing speech, remembering names, or following conversation threads can feel impossible. But pulling away from others accelerates decline. This symptom deserves both empathy and intervention. Inappropriate behavior. Do they say offensive things, touch inappropriately, or act impulsively in public? This isn't just bad manners. It could be frontal lobe dysfunction. Disinhibition is common in dementia, especially frontotemporal types. Caregivers should understand. It's a symptom, not a choice. Strategies like redirection and calm responses are key. 6. Short-term memory loss. Did I already tell you that? Becomes a daily refrain. They may repeat questions, forget what they had for lunch, or misplace objects constantly. Long-term memories often remain intact early on, which can be confusing for families. But that short-term lapse is one of the most critical early signs. 7. Hallucinations. Do they report seeing people who aren't there, or hearing voices? Visual and auditory hallucinations, especially vivid ones, are often seen in Lewy body dementia. They can be terrifying for the individual. Never dismiss these reports outright. Gentle validation and medical support are essential. 8. Incontinence. A sensitive but important topic. Bladder or bowel accidents may begin to happen. Why? The brain loses control over bodily signals. This leads to late recognition of the need, or inability to find the bathroom in time. Compassion, dignity, and practical tools, like reminders or easy clothing, go a long way. 9. Mood swings and behavioral changes. Sudden outbursts, anxiety or tears, without clear triggers. The emotional center of the brain, is also affected in dementia. A calm morning might turn into an angry outburst within minutes. Understanding this as a symptom, not personality, is key for caregiving. 10. Misplacing items in odd places. Glasses in the freezer, remote in the bathroom, shoes in the oven. This isn't simple forgetfulness. It's confusion about purpose and place. As dementia progresses, this happens more frequently and creates tension within households. Labels, routines, and structured environments can help. 11. Trouble solving problems. Paying bills, setting a timer or adjusting a thermostat suddenly become daunting. Analytical and logical thinking decline. Even for people who once handled complex tasks, offering step-by-step support without patronizing is a delicate but vital balance. 12. Disorientation in time and space. They wander off in familiar areas or forget how to return home from a neighbor's. This can pose serious safety risks. Installing visual cues, GPS trackers, or even alert devices may become necessary in advanced cases. 13. Repeating the same question over and over. They ask something, you answer, and 2 minutes later, they ask it again. It's not defiance, it's memory failure. The frustration is real, for both the person and the caregiver. But this symptom is often one of the clearest indicators of cognitive breakdown. Repetition deserves patient, clear, and calm responses. Understanding the root causes of dementia. While Alzheimer's disease is the most common culprit, it's not the only one. Alzheimer's is caused by protein buildup, amyloid plaques, and tau tangles that slowly kill brain cells. Vascular dementia follows strokes or reduced blood flow to the brain. Lewy body dementia involves abnormal protein clusters, leading to hallucinations and movement issues. Frontotemporal dementia strikes the areas of the brain controlling emotion, behavior, and speech. Risk factors include age, family history, poor cardiovascular health, smoking, sedentary lifestyle, and even chronic stress. Can dementia be prevented? Or at least delayed? Here's the empowering truth. While there's no guaranteed prevention, you have more control than you think. By focusing on brain health now, you can build cognitive resilience. Here's what helps. Stay mentally active. Puzzles, reading, learning new skills, exercise regularly. Physical activity boosts blood flow to the brain. Eat brain-friendly foods. Think omega-3s, antioxidants, and plant-based nutrients. Sleep well. Restorative sleep clears brain toxins. Socialize. Connection stimulates mental engagement. Control vascular risk factors. Manage hypertension, diabetes, and cholesterol. Every habit you build today becomes your brain's insurance policy tomorrow. While there's no cure yet, the landscape is shifting. New medications, earlier diagnostics, and innovative therapies, from light therapy to digital cognitive training, are showing promise in slowing progression and improving quality of life. Conclusion: dementia may be one of the greatest medical challenges of our time, but knowledge, vigilance, and early action remain our strongest tools. By understanding the early signs, recognizing the classic symptoms, and adopting practical, science-backed prevention strategies, we don't just delay decline. We preserve dignity, independence, and connection. If this video gave you clarity or hope, consider sharing it with someone who might need it. And for more science-driven, human-centered health insights, subscribe to Science of Wellness, because together we can face the future with strength, purpose, and compassion.